You're listening to Stellar Success, Leveling Up for Medical Pros with Dr. Tudor Francu. Join us as we explore how medical professionals can achieve stellar success in all areas of life. It's time to level up.
Hello, everyone. We're back at Stellar Success Podcast. I have an interesting guest tonight, someone who goes through different sides of medicine, up, down, east, and west, and comes out a successful provider and a successful businesswoman. Dr. Alaina Rajagopal from Southern California. How are you, Doc?
I'm good. Thank you so much for having me.
Absolutely. I want to start over with a little bit of overview of your journey. If you can give us a little bit of, how do you start? What was your journey like, and where are you now?
Sure. I was always kind of a science nerd, but grew up in a family where nobody was really in science. So it was very much kind of trying to figure out my own path over time and, participating in science fairs and stuff like that as a kid. I decided to major in biology when I went to college, and had always been really interested in aerospace. And so got my first internship at NASA, my first or second year of college. And that really kind of changed the trajectory of what I wanted to do. I was so inspired and enjoyed the experience so much that I decided I wanted to go into space research. So worked at a couple of other NASA centers the following few years of college. Also dabbled in a few other types of science, paleontology, conservation biology, and eventually decided to go to graduate school to pursue a PhD in, like I said, space life sciences, but it was through a public health and epidemiology program. So also studied those things as well. Um, and so about halfway through graduate school, I felt like I was really focused on virology, sort of immunology, one part of the body, and I really wanted to understand kind of how that fit in to the rest of how a human worked as an organism. And so kind of started thinking about going to medical school, studied for the MCAT and all my spare time as a PhD student, and then went to medical school after that, continued studying aerospace topics, doing research, but also really enjoyed global health. And so did some trips abroad to kind of learn some of the basics of infectious disease and travel and tropical medicine. And so it was all of those experiences that really left me wanting for better diagnostic tools, particularly in some of those remote and austere environments. And so that led me to talk to my husband, who's also a engineer and physicist, about what we could do to improve some of these diagnostic tools. And that ultimately led to our discovery of resonance sonomanometry and the founding of our company, Esperto Medical. So I continue to work on that and practice emergency medicine.
Practice emergency medicine while you're studying for your PhD and researching on your company and doing global traveling and learn about virology and paleontology. You're a very accomplished physician just by doing that. I want to see how you did it.
Say that I have career ADD, but I definitely have had some interesting experiences.
How did you spare your 24 hours a day into doing all those things?
Yeah, I mean, I was super regimented with my time, especially when I was in graduate school, working on my PhD, but also studying for the MCAT. So, I'd go to work early in the morning and do all of my experiments, take care of my cells. I was doing a lot of cell culture. And then I'd maybe work out for like 30 minutes or an hour, go for a run. And then the other part of that 30 minutes to an hour would be eating dinner. And then I'd start studying for the MCAT. And that was kind of um, probably a year of my life just kind of going through those things. And then that transitioned into applications for medical school. And so, I've always had to be very scheduled and to make sure that I'm very efficient with my time. And I think that's served me well. But I've also made sure to leave some room for fun and enjoying activities outside of work. But I'm really fortunate to be in a career that I love. So it doesn't necessarily always feel like work.
Yeah, I think that's very important. It doesn't have to feel like work.
Yeah.
Is that success for you?
Yeah, I think so. I remember being a kid and having my parents tell me, find a career that you love and you'll never work a day in your life. And I think there's some truth to that. I think doing the things that I've done have also required a lot of hard work and a lot of early mornings and late nights and lack of sleep or no sleep, particularly in medicine. But I think ultimately it's gotten me to a place where I feel like my intellectual curiosity is really satisfied, and I'm constantly challenged with new ideas and new things, and that's been really, really fulfilling.
Why emergency medicine?
Yeah, it was something that when I was in the middle of my PhD and working at NASA, a lot of the physicians working at NASA were either in emergency medicine or internal medicine. So those were kind of the main things that I thought about. And then with my background in virology and immunology, I kind of thought infectious disease might be where I wanted to head. But when I went through medical school, I found I really enjoyed everything, and I was having a hard time kind of choosing a particular specialty, and infectious disease felt a little bit too specialized, and I liked so many of the other rotations, that ultimately I decided with emergency medicine I'd get to practice a little bit of everything. You don't necessarily get the depth that you would say in like surgery or obstetrics and gynecology, but you get to do a little bit of all of those different specialties. And so I think that's something that really uh, made it attractive to me. And then also, it's, one of the few places in the hospital where you can really get truly undifferentiated patients. Somebody walks through the door, you have no idea what that's going to be. And that aspect of problem solving is really appealing to me.
Yeah, that's very important. I totally understand where you're coming from with your thirst of knowledge. Um, that certainly fits your profile. Now, let me ask you a thing that, I'm very curious for a doctor who practices emergency medicine, um, and also has all this other interests in other things. How do you evolve from being a doctor into being an entrepreneur right now with your company? What made that change? What kind of factors did you have in your life to get you to that level?
That's a really good question. And I would say I became an entrepreneur almost by accident. It certainly wasn't something that was in my life plan. I didn't grow up being like, I'm going to start a company someday. It was very much through my practice, I found a need for a new kind of technology. And so started doing research on how medical diagnostics could be improved, and particularly blood pressure monitoring. And so,
Hmm.
as we continued to pursue these different research topics, it became obvious that we'd actually discovered something really exciting, and that the resonance sonomanometry technique that we developed could actually be really helpful in the hospital in more ways than just blood pressure, but with potentially diagnosing all types of diseases and pathologies. And so, with that, and also just the difficulty of getting academic funding, we decided to spin out into a company. And through that, we were able to get venture capital funding. And ultimately, that allowed us to continue the research, keep building the device, and start doing clinical testing to prove that it actually worked.
Yeah, I definitely need that kind of technology, at least in my life. I'm an anesthesiologist, and I always thought about something better has to be
Yeah.
invented about the way we monitor patients these days.
Every time I place an arterial catheter, I'm like, there has to be a better way.
Yeah. So tell us
Yeah.
a little bit more about your technology. How does it function? Are you a busy medical professional striving to excel in life and work? Stellar Success Podcast brings you the habits and insights of top leaders in medicine and beyond. Discover strategies for balance, growth, and fulfillment in every episode. Follow us on Instagram at Stellar Success Podcast for daily inspiration. Start your journey to success today. Subscribe to the YouTube channel now. How can it help? And what kind of devices did you develop?
So the technology itself was based on a need for blood pressure monitoring that is non-invasive, continuous, and doesn't require calibration. And so you can measure blood pressure with a blood pressure cuff, which is, I think, what most people are familiar with, but you don't get a lot of information out of that. It's uncomfortable. You can't run it frequently enough for a lot of clinical cases. And so, your alternative to that's really an arterial catheter, but that's sticking a needle in a catheter into somebody's artery and then connecting them to long tubing, which obviously has a lot of drawbacks and potential for complications for patients. And so there's a whole bunch of tools that have been developed over the last couple of decades to measure non-invasively and continuously, but they all require calibration. And as an emergency medicine physician, I don't have time for that. And working in austere medicine, if I have to bring a blood pressure cuff and also this tool, I'm just going to bring the blood pressure cuff and not worry about the extra weight. And so we really felt like we needed to find a way to be able to measure non-invasively and continuously and without calibration. And so ultimately we settled on ultrasound, and then we realized we could use audio frequency sound to induce a resonance in the wall of the artery, kind of similar to a guitar string. So the tension in gosh, I can't talk. The tension in the guitar string then relates to the overall pressure or tension. And so we measure the arterial radius, the arterial wall thickness, and then this resonance in the wall of the artery, or the arterial stiffness or tension. And with those parameters, we can directly calculate blood pressure many, many times per second. And so with that, we get a continuous arterial waveform. And then we also get a whole bunch of other really interesting information, like dilation or constriction of the blood vessel, changes to the wall thickness that could occur over time due to various types of pathologies. And so we can do a lot of really interesting things with just this one technology.
Yeah, so it's completely non-invasive and continuous monitoring, which is great.
And I think the other interesting and unique feature is that because it uses ultrasound, it can be used on any artery visible to ultrasound. So we can look at the brachial artery, the radial artery, or central arteries like the carotid or subclavian, or even look at the femoral artery, or anywhere that's interesting for different use cases. So that's something that to me is really exciting, in that I like having flexibility for what I can do based on different pathologies and cases. And so I think this technology gives you that additional flexibility.
Yeah, this is very interesting. I want to go back to your personal approach to this. What do you think are the habits or routines that you have in your life that don't get enough credit for where you are right now, successful that you are right now?
I think advice that people had given me for my entire career is to just focus. People were always saying, you're interested in too many things. You need to just focus on one thing. And I think that that's the right advice for certain types of people or certain types of studies. But for me, I feel like that was sort of counterintuitive to what I really wanted to do. And so I think probably just being able to do a lot of different things and understand and learn about different things has allowed me to think about problems from different perspectives. And without all of those different experiences, I wouldn't have that knowledge to kind of think about alternative approaches or doing things differently than they've always been done. So I would say that that sort of tried and true approach of just focus and do this thing a million times and you'll be really good at it wasn't necessarily the right thing for my career. And I know there's probably other people out there who feel the same way and could also benefit from.
I think it's a trait
breadth.
of a successful entrepreneur in medical field. I think the fact that we constantly need to question the status quo of things that we do day in and day out for years ongoing, and we don't even question that. We do it because that's how it was done. Change is hard. We don't want to change, but there's some people out there like yourself where they question things, and they have great answers to their questions, and that's how change is produced by what you guys are doing. But I'm sure you went through some hardships probably, and setbacks and failures to get where you are.
Yeah.
What are those? Tell us about this.
I mean, there's too many to fit into just one small podcast, but I would say probably one of the more recent failures was when we started looking at this blood pressure problem. We thought, oh, we should probably be able to measure blood pressure using blood velocity from ultrasound. But what we found is that we got close, but it would still require a calibration step. And so we threw that away, failure. And then we were like, well, what if we had machine learning? And we had our co-founder, Yasser Abu Mustafa, one of the preeminent experts on machine learning in the world, working on the problem with us. And ultimately what we found is you can use machine learning, but will fail in unexpected ways and unexpected patient cases. And you can't anticipate every possible physiologic variation for the 8 billion people on Earth, because your machine learning is only going to be as good as your underlying data set. And so you'll be limited by kind of what's seen in that data set. And so we threw that method away. And that was another failure. And so ultimately went back to the drawing board, literally. I remember we were sitting using a chalkboard, and developed resonance sonomanometry, our current method. And so I think, we could have adopted any of those two methods and said, this is probably good enough, it'll get us close enough, and gone from there. But I think sometimes it takes a lot of courage to say, I'm throwing this away, even though I've worked really hard on it. One of the methods, we did a 300 subject clinical study and ultimately said, this isn't good enough. And so I would say those are failures that ultimately turn into successes, because I think every time you fail, you have to think critically about what went wrong and figure out how you can fix it, how you can do better on the next round.
Yeah, I think that's essential. The fact that you didn't quit after all those failures, it's probably the explanation of you being successful in this field. The way you deal with failures is probably the definition of a successful entrepreneur.
Yeah.
And you
Perseverance
finally,
or stubbornness, one
right,
way or the
right.
other.
Yeah, it's and you don't take things personally at all in this process, because the moment you start thinking, oh, I'm not good enough, I'm not doing enough things to succeed, maybe I should do this or do that. It's just a persistence game. It's a consistency game. It's a non-quitting game. um,
I think as
Now,
a researcher, you have to be willing to kind of step back from your data and look at it completely objectively and not have that sort of personal feeling attached to it. Because that's, if you're too attached to a particular outcome, that could potentially influence your results. And so I think that's one of the most critical lessons as a researcher, is just having that willingness to step back and say, this is good enough or it's not. And if it's not, move on.
yeah, that's a good point. That's a good point. Um, what do you do every day to be like this? Do you have any things that you like to do, your routines, your habits? What do you advise people to be consistent with?
I think that's probably unique to every individual. But I have to do things that sort of bring me happiness or make me feel refreshed. And so for me, that's being outside, getting exercise, spending time with my family. But also, like I said before, I really enjoy what I do, and it kind of makes me get out of bed in the morning and take the next step and think about what we need to do to continue to improve the technology that we're working on. And so I think all of those things are part of my day and a part of my schedule, and um, things that help make me feel like I've accomplished something in a day, I guess.
Yeah, that's very nice. Now, with all your experience so far and things that you learn along the way from all your studies, um, and your failures and your successes, if you would look back at yourself when you started this whole thing, what kind of advice would you give to yourself?
That's a really good question. I mean, I think, in those moments, there are sometimes feelings where you want to just give up. And so I think that advice would be just keep going, just keep putting one step in front of the other, and eventually you'll get where you want to be.
Yeah, that's really nice. Alaina, what's new for you this year? So, what are your goals? What are you excited about? What's going to happen next?
Well, I'm really excited because Esperto just closed our Series A financing. So that's really exciting. It's given us the capability to, again, kind of just keep moving forward, keep improving the technology, do clinical validation. So that's something really exciting. And I'm looking forward to continuing that with the whole team.
Very nice. How can people learn more about this project and technology and the way you're gonna move forward?
You could visit our website, esperto.health. And then we've also published a paper on our methods in PNAS Nexus. So I would definitely encourage people to go to either our website or read the paper. I think we have a newsletter or mailing list you can sign up for on the website. And yeah, let us know your interest, and we're always happy to reach back out and answer questions.
Very nice. Thank you very much for coming over and tell us about your project. It's very
Thank
interesting,
you
and
so
I hope
much.
to succeed in everything you do.
Thank you.
That's a wrap on Stellar Success, Leveling Up for Medical Pros with Dr. Tudor Francu. Interested in joining us? Go to stellarsuccesspodcast.com/guest to apply. Stay stellar and level up.